What should you expect after an in-office post-nasal drip procedure? I'm Dr. Manan Shah. I'm one of the ENTs with Colorado Ear, Nose, Throat Group. In this quick video, I'm going to talk to you guys about what should you expect after you have one of these surgeries to try and decrease post-nasal drip. So, a lot of patients have post-nasal drip. It's really frustrating, and we can do two types of procedures, either a Clarifix or a RhinAer or a turbinate reduction procedure that will hopefully help decrease some of the post-nasal drip and help you breathe better. These procedures are done in the office and you usually go home right away. After these procedures, what you want to expect is one, it's normal to have a little bit of pain and pressure and swelling in your nose. In fact, typically the patient's noses will swell up and they'll feel more congested for a few days to even a week or two after the procedure than they did before. Two, it's normal to have a little bit of dripping and bleeding. Anytime we do a procedure in the nose is an incredibly sensitive area, and so it's not abnormal to have a little bit of dripping or bleeding or oozing, and as long as it's not a ton of blood, if it's just a little drip, that's totally normal for a few days to maybe even a week. The third thing is we don't want you to blow your nose too hard, because anytime we've done a procedure inside your nose, if you blow your nose super hard, you could move some of the scabs, and that could increase the odds that you get a nosebleed. Most of our patients will just take Tylenol and Motrin, and we generally ask that you take it easy for about 1 to 3 days. No heavy lifting, no crazy climbing mountains or anything like that, just to make sure you don't move the scabs and get a bad nosebleed. If you have any questions after your procedure, you can always call our office. There's always a doctor on call, but in general, most patients should expect a little bit of bleeding, a little bit of pain. They should take Tylenol and Motrin, and they should be okay otherwise. You can eat and drink anything you'd like, and then the most common question we get from patients is, when will I start to expect to feel better? For this procedure, we expect that you might start to notice a benefit between 3 to 6 weeks afterwards. So it takes a little bit of time for your body to stop making that mucus. And lastly, unfortunately, we always tell people there's a percentage of patients who it doesn't work for. The human body is complicated, and while we always do our best to try and fix it, we want to be honest that we can't fix everyone's problem. But for most of our patients, they get a really good outcome, and we've been really pleased with how our patients have done after this procedure. Hopefully this video is helpful and it gives you the instructions to know after the surgery. And if you have any questions, please feel free to reach out to our office. Thanks so much.